Вийде дуже прекрасна фахівчиня,
presenter, an amazing expert, Charlotte Osborn-Forde, who is the CEO of the National Academy for Social Prescribing. We've been discussing this topic extensively. We have dedicated an entire panel to social prescribing, and we will learn more about the UK experience in this area.
Hello, everybody. Hopefully you can hear me and see me on screen. I'm very pleased to be here today to talk to you about social prescribing and how it developed in the UK to be a national system and part of our healthcare. My name is Charlotte, and I'm the Chief Executive of the National Academy for Social Prescribing in the UK, and we are also a World Health Organization collaborating centre for social prescribing policy and development. And that means it's part of our role and remit to help other countries, their NGOs and governments to learn from our journey in England and to develop their own approach to social prescribing. I'm hoping you can see the next slide, which just tells you a little bit more about the National Academy for Social Prescribing. We are funded by the UK government to support the development of social prescribing, focusing particularly on connecting up different sectors and organisations. So the community and voluntary sector, particularly with the National Health Service, but also beyond the health service, thinking about arts and culture organisations, heritage, sport, nature-based organisations, and community. We also support with the development of innovative new models for social prescribing. And we advocate for and try to channel more funding and investment into social prescribing systems, particularly to support community organisations. We champion and drive the best quality evidence, including academic research and patients' own lived experience. And we raise the profile of social prescribing to help people and patients know that it is available and what it means. This slide explains what social prescribing is, and it's great to hear that you've already discussed and talked about social prescribing. There is now an official definition for social prescribing, which has been agreed by organisations working across the world. And what we see in this definition is a three-part process for social prescribing. Trusted individuals, such as doctors or nurses, or leaders in the community, such as community workers or faith leaders, can work with a person or a patient who has health-related social needs, and to work with them to co-produce a prescription, not for medical support, but for community-based support, and then to connect them into community interventions and activities that support their health and well-being. So social prescribing is a process that the person or patient is at the heart of that process and determines what their prescription looks like. In England, social prescribing started many years ago, about 20 years ago, and it started under the leadership of doctors and community leaders working locally to find solutions for problems focused around mental health and other conditions. After 20 years of collaboration and working together, eventually our government in the UK recognised the importance of social prescribing as a possible solution. And in 2019, our health service, NHS England, finally embedded social prescribing within the health service. And this statement from the time says that the investment in social prescribing legitimizes non-medical and community-based activities and holistic support alongside medical treatment. So at this time, the government decided that they should fund social prescribing as a legitimate and verified part of public healthcare in England. So what does this look like in practice? In England, social prescribing is delivered through a new role within the health service called a social prescribing link worker. In England, all National Health Service, general practice doctors, primary care doctors, they must offer a social prescribing service to their patients, and they draw down funding from the government to pay for the costs of employing link workers. Alongside this funding, there is detailed guidance and frameworks from the NHS to talk about how social prescribing works and what is the role that link workers do. In England, social prescribing link workers are what we call a Band 5 NHS role, and that is the equivalent to a junior nurse. And so that means a professional approach which requires a level of competency and skills. Those skills are focused on engaging and supporting people with the most complex needs that have both social and health needs, and providing support to them to help them see that they have opportunities in their community to enhance their health and well-being. Social prescribing link workers are unique within our health service because, as you will see from the diagram on the slide in the centre, the yellowy orange colour, the social prescribing link worker is employed to give time. So they are unique within our health service, for other members of staff will be employed to treat patients or to address a mental health concern. Link workers' focus is on listening to the person or patient and helping that person understand what matters to them and what are the opportunities in their life to improve their health and well-being. What do link workers do? The most important thing that link workers do in our model is to develop a trusting relationship with the person or patient and give them time to tell their stories and talk about what matters to them. An important element of this is to develop a plan with the person, the co-prescription. This plan should look at what matters to the person, their priorities and interests, their values and motivations. It should look at what community groups and services exist that the person could access and how they will be connected to them. What the person can expect of those community groups and services. Some community groups will be very small and they will not be able to provide lots of support. Other services might be delivered by the government or funded and much more supportive and thorough in their engagement with the person. The plan should also look at what the person can do for themselves to keep well and active. Could they make use of provisions and services in their community, such as local parks, art galleries, or museums? And what other resources do they have in their lives that they could draw on? Their friends or families, their hobbies. Link workers could see people up to 12 times over a 3-month period, and that could be seeing them in face-to-face or over the telephone or virtually. And link workers will typically support around 250 people every year. So it's a fairly intensive service for people to help them move forward in their life. There is no typical social prescription because social prescribing is inherently personalised. It's about what the person would like to do. And there are many, many different groups, services and activities that people could be connected to. So these could include government and statutory services, small community groups and neighbourhood groups, charities, NGOs and voluntary sector services, as well as local infrastructure such as a park, a library or a museum. Each person's prescription will be tailored to their needs, but typically we talk of 4 pillars of social prescribing. And these are thematic areas that most people should consider when developing their plan. They are how to be more creative, how to be more physically active, how to reconnect with nature, and how to reconnect socially and with your community. And a plan should look at those 4 areas and think about what's available in a local area to meet them. Link workers should measure the difference they are making with patients and collect data on this so that we know that they are having an effective contribution. In England, we use a measure which is known as ONS4. ONS4 is a UK national wellbeing measure that enables link workers to benchmark their work against other government and charity-funded services. ONS4 looks at 4 measures for a person's well-being: happiness, life satisfaction, life worthwhileness, and anxiety. And people are asked to score themselves on a numerical score between 0 being the very worst and 10 being the very best. This data is then used to track whether social prescribing is making a difference to patients and people's well-being. Social prescribing in England is very much delivered through primary care and GP practices. However, increasingly other countries and other healthcare systems are embedding it in different parts of the healthcare service. This report from Austrian Public Health in partnership with the WHO analysed where different countries are embedding social prescribing within their healthcare system. I've put a link into the slide and you will have the slides afterwards to follow up, but you will see from the diagram that in Canada, for example, it's in both a community setting and a primary care setting. Only in Singapore and in England so far is it within hospitals, but this is changing quickly. We would say that all settings are appropriate for social prescribing because it is focused on the person and the patient. So it does work in a GP, community and primary care setting, and it will work in hospitals, wherever there is an assessment of a person's social health and a need to connect them to interventions. What has been achieved in England since the NHS embedded social prescribing in 2019? Well, we now have over 3,000 NHS social prescribing link workers. All GP practices and all patients can now access social prescribing. During the rollout period of 5 years, the government set a target that 900,000 people would be referred by their doctors to social prescribing link workers. But we can now see that it was 5.6 million patients that were referred. This shows that there is very high demand, both from doctors and from patients, to our social prescribing service. We have very robust evidence, including academic research, and I'll share a few examples shortly. In England, around 24% of the general public now understand the term social prescribing, and 97% of our GP doctors are favourable to it. There has also been an awful lot of media attention, the press, publishing and online, talking about social prescribing and how it makes a difference. Often, these are patients that have been through social prescribing, wanting to share their stories of how it makes a difference. We often hear patients say, "It saved my life," or is a lifeline, because it was the first time that somebody really listened to the person and what they wanted and looked beyond the medical system at what could make a difference to their health and well-being. In England, social prescribing is reaching people who could most need it. We talk about deprivation, which means the poorest areas of England, which have the worst services and the biggest struggles with health. Data from our partners at UCL shows that social prescribing reaches people who are living in the poorest areas with the most complex needs. We have also done national population level research to understand if social prescribing works as a national solution. This academic report from Manchester University, published last year, looked at over 4 million pieces of data from patients, and it found that social prescribing at a population level was improving the health service and helping people feel that their mental health needs were understood. So this looked at the 4.1 people living in England, not just people who had accessed social prescribing and had an intervention. At the Academy, we do our own research and reports, and this is an example of data which shows that social prescribing is reducing unnecessary demand on the health system. For example, if somebody sees a link worker and they feel more in control of their health and their mental health and better supported in the community, they are less likely to have an unplanned admission to hospital or attend at the emergency room, and they're less likely to need regular input from their GP or doctor. There are many other countries embedding social prescribing, and this report, which we are just about to update, talks about how social prescribing has been embedded in over 32 countries around the world. There are also large-scale programs in other countries that are exploring how social prescribing can be embedded in health systems to make a difference. This program is funded by the EU. It's called Social Prescribing EU, and it looks at social prescribing in 8 countries to test, using a randomized control trial, whether it is an effective approach to support vulnerable people. The findings will be available over the next few years, but this is a good indication that other countries see social prescribing as a high potential intervention. In Greece, there's recently been a randomized control trial for arts on prescription, which has led to a change in the law making arts on prescription available for people with psychiatric needs in Greece. At the moment, a preprint of some very important research has been published, and it concludes that art on prescription, when added to care as usual, improves depression and anxiety, and that it's a scalable and person-centered approach which could be adopted. These studies, we hope, will be the first of many to explore how social prescribing can be further embedded in mental health and primary care and other parts of the health system. We have lots of resources and information on our website, and we're very happy to help other partners and agencies around the world. Thank you.
Thank you, Charlotte. Stay with us, please. And I will introduce Svitlana. She's here, moderator of our next panel.
Whoever needs interpretation, make sure you have your headphones.
Я представлю спочатку, а потім представлю наших панелістів.
Myself and our panelists. My name is Svitlana Soloviova. I have a background in medicine. I work with clinical and economic research focused on healthcare. And I am also the head of an NGO, Pro Health. My path towards the topic of prescription art started from me coming across an article about an economic study of this social prescription. The study was from the UK, and it showed how engaging different art practices and how a contact with culture can allow a country and can allow individual patients to receive economic benefit. I was impressed because as a doctor, I understand the value of art. As a doctor, I understand it's important, but the economic benefit was the news to me. It was impressive. So I started searching more information on it. And this is how I learned more about it. So I would like to say thank you to our panelists who are going to participate in the discussion. And together we are going to talk about the concept of art prescription or social prescription. And we are going to talk about it specifically in this framework of the benefits of it. And let me first introduce Chris. Well, frankly, I think that Chris does not need any introduction. However, I will introduce him, former head of art and health at the WHO, but I think that there are never former heads of art and health because you're so engaged in the process. So thank you, Chris, and I think everybody agrees. A round of applause for Christopher, that you actually created this area of art and health in the world, as far as I understand, and you are one of the renowned experts. No microphone, we cannot hear his response. We cannot hear the speaker without the microphone. And Iryna Kylynych, you're saying Kylynych, right? So, Deputy Mayor of Lviv for Humanitarian Affairs, Iryna Kylynych. So, such a nice woman, working with such a heavy burden, such as medicine, education, help to the wounded, the social work aspects, culture and sports. So you're dealing with all of that. We're happy to have you with us. Your expertise will be highly needed and valuable here. Welcome. Welcome, Iryna. And Oleh Bereziuk, head of the mental health center at the UNBROKEN Center, Rehabilitation Center. I would like to ask you, and Charlotte is with us today. Charlotte, thank you for joining us today. Once again, Charlotte is director of the Academy of Social Prescribing in the UK. She's the CEO of the National Academy. And I would like to ask the panelists who have just joined us to share a bit about your work. How did you come to work in art and health topic? Maybe a couple of sentences. Well, men are here to support me. Anyway, welcome at the first Territorial Medical Union. And I think you know that this is our City Territorial Medical Union that was established not so long ago, in pre-COVID times. And this union took on a grandiose role in terms of rehabilitation of all those affected by war. And then the union took a leadership role in reforming the medicine in the city of Lviv. However, as Svitlana just said, we don't have former heads of this area. So right now we have Oleh Bereziuk with us. He is my colleague. He was also the deputy of the city mayor on humanitarian work. So for many years we've known each other. He did work as psychiatrist, right? Maybe you can diagnose me after so many years of work. However, let me tell you that I have never worked in the humanitarian area before. My background is in engineering and economics. I graduated from the Institute of Oil and Gas. I have 22 years of non-stop experience working at a large chemical enterprise, and it happened in the previous life. After that, I faced with the challenge to work in the local government, and for about 20 years, I am now living and working in Lviv. I'm serving the community of the city of Lviv, and for about 16 years, I have been the head of the economic growth department. When the large-scale war started, it so happened in my life that I accepted the challenge to to work in a very complicated unit in the Department of Humanitarian Policy of Lviv. And I think further in our conversation, I will share a bit more. Thank you. Thank you for your service. Thank you for accepting the challenge. And I think a lot of us have accepted this challenge because art and health is quite a serious challenge to face. Oleh, over to you. Oh, I apologize, somebody else grabbed the microphone. But anyway, hello, my name is Oleh Bereziuk. I'm a psychiatrist and psychotherapist. Indeed, I have experience working in the state service. I was deputy city mayor. I worked in the parliament, in the Ukrainian parliament. I was the head of the parliamentary faction. And over these 10 years of my state service, I always dreamed of coming back to medicine and of working in psychiatry. And I did return to this area in 2019. After that, we faced many challenges such as COVID and the war. So we had to change the approach that we had to mental health. And as you know, we had this post-colonial approach to mental health, right, to put it mildly. And we faced a large stigma related to mental health, and it had two reasons. The natural one, people are scared of going crazy because there's a stigma there. And secondly, Ukrainian psychiatry remembers this punitive psychiatry when instead of concentration camps, people were sent in the Soviet times to psychiatric hospitals. So we made this decision that based on the hospital, we will create a new mental health center. It happened half a year before the large-scale war. And it started working half a year after the war started, the large-scale war started. Then we faced another huge challenge in terms of the numbers of patients who need our help. Patients with serious trauma that we have never seen before, both physical, mental, and moral trauma, sometimes combined all together, and it was horrible. And these numbers are only growing, and it's a horrible challenge that has not been yet addressed. So we started searching not just for doctors that need to be retrained. All of us have gone through retraining over these 5 years because the knowledge we had before war does not fit the war times. So we started looking for different ways. And I don't know, well, not knowing yet much about social prescription, we found, we started engaging in art therapy, and we saw how effective it is as prescription. It's not just drawing, it is indeed a prescription, diagnostic prescription. It is a powerful instrument that has a powerful effect. So we started working in this area, and we will talk about it today. Thank you.
Before I introduce myself, I actually just want to acknowledge Dr. Oleh. My visit to his ward 2 years ago literally changed my life and my conception of what arts and health is and what it could be. And I think from that, it's actually changed the world. What you're doing here is innovative, and it will amplify. So, yes, I will. Absolutely, yeah. And I also want to acknowledge this audience. When I was a little boy, I was fascinated with the Greek myths, and one of the myths that I loved was the myth of the Amazon warriors. And I always thought that this was an interesting fantasy until I found out a number of years ago that they actually found near the Black Sea the ancient Scythian burial grounds where you had these women who were buried with armor and were about 4 inches taller than the men that were buried with them. So they actually existed. And I wondered, what would it be like as a man to be in a society run by competent, strong, brave women? And after this week, I know. And it feels good. So thank you. I just finished up my tour at the World Health Organization after 23 years, and I went through several different incarnations. The first period of my WHO career, I was hired to create a knowledge management strategy for the World Health Organization from the Rockefeller Foundation, where I was working earlier. And it was a 2-year contract, and 23 years later, I was still there. In the second period of my time at WHO, I created the health informatics department. And this for WHO was quite revolutionary because all of the information systems that we had created and implemented were all about program reporting. They weren't about patient care. And this was a real revolution for us to go into HIV clinics in rural Africa and later around the world and to design systems that were specific to improve care and to improve facility management, not just to report to donors and to national governments. But to do that, you had to integrate the information so that you could accomplish both. And that basic premise of being able to incorporate continuous improvement, to share stories as clinicians once a week, to value not just reporting data, but to make that data active, to improve patient outcomes and a sense of ownership of the clinical staff. That also began to gestate in my mind about how one does that through storytelling, through the arts. And that's what directly led to the Arts and Health program that was the third chapter of my WHO life. When Dr. Tedros was first elected Director General, he put out this famous call to staff for crazy ideas. And I got my 5 minutes to pitch this idea, and he said yes. And now it's become a global phenomenon, really, at that level. It had existed for many years before. I didn't create the sector, but I think what I did do is plant a WHO flag, which energized the sector in a particular way. I also helped create something called the Jameel Arts and Health Lab, not realizing that when I left WHO, I could hire myself and continue the work, which was a very nice thing. And but the main focus of the Jameel Arts and Health Lab is to look at the health benefits of the arts from building up the research and evidence base to engaging in the capacity building, in developing the policy environment, and also to invest in real life on the ground implementations to help build up that evidence base. Just in one sentence, right now I'm very much focused on the policy frameworks around the world, and they include things like being able to work with governments to establish sustainable funding models, to pay artists to be part of the system, to make sure there's a regulatory environment where we can limit the potential for harm and maximize the potential for not only quality, but scalable quality that reaches the most underserved populations. And so far, we had Sir Gregor there. The Scottish framework for social prescribing came out of Healing Arts Scotland, your cousin. And it was that event that led them to realize we need a framework. And we help them with that. We also, in the US, in an environment that is incredibly polarized politically, after our Healing Arts Atlanta, we helped write legislation at the state level that was passed not only in a bipartisan way in a polarized environment, but it was passed unanimously. It was the only piece of state legislation in the US to pass unanimously last year. So what we're doing, and I think it speaks to the power of both art and health itself, has a unifying effect. Instead of dividing people, it brings them together. And I think that's one of the most beautiful parts of this mission, and I've spoken too long.
Шарлотт, мы бы хотели тоже вас попросить поделиться тем, как вы...
Charlotte, are you with us?
Yes, I'm with you. Can you hear me?
Вибачте, просто я перейшла на російську мову.
I'm sorry, I just switched into Russian because of how nervous I am, because I was raised in a Russian-speaking environment, and sorry for this slip of the tongue, so to say.
Шарлотт, а поділіться з нами, будь ласка,
Charlotte, could you please share with us how did you end up in this sector of arts and health? What was your journey, and how do you continue having this revolution and having this powerful dimension of social prescribing, supporting it, and evolving?
Yes, of course. And thank you for asking. So I took a degree in history of art when I left school, and had a real passion for the creative arts and heritage, but then found myself in my career working in community organizations because I had personal experience in my family of poor mental health. I was fascinated by what charities and community groups can do for people with psychiatric and other mental health conditions. So I spent probably 10 years working directly in and with communities, supporting people to access volunteering, social activities, and then increasingly trying to design programs and systems that were better, because I could see so many flaws and issues with mainstream, both public services and community services. And then over time, progressed to leadership roles within charities and within community groups, mostly focused on mental health and people with complex inequalities. So people who'd experienced childhood trauma, complex poverty, and other issues. And social prescribing sort of became on my horizon in around 2015, when it became discussed in England amongst both charities and community groups. And at that time, the health system did not seem interested in communities and in the work we were doing in communities. And we would often go to doctors and to health services and say, we have these services, these organizations, this work, and no one listened. And then social prescribing seemed to suddenly be more on the public consciousness and more talked about by doctors and the health service. And leaders in the health service began to talk about it. And we saw a really big shift quite quickly once politicians could see the value in it. So now I'm the CEO of the National Academy for Social Prescribing. And I think what we see in England is a recognition that all of the work that was previously hidden in communities is important and should be valued. What we haven't seen, and I noticed Christopher's comment about sustainable funding, we haven't seen investment in communities and arts organizations in England. So much of my work now is about talking to the government and government agencies to say, this doesn't just have a role on the periphery, accessed through link workers as per our model, but we need to see that the health creating and well-being improving benefits that I have seen over many years and is now recognized in the evidence. We need a parity of esteem with medical solutions and community and creative solutions. So much of my work is about championing that evidence, and more recently focusing particularly on the arts, which, as I started with, is my sort of personal passion, and really starting to explore, just as you mentioned, the economic benefits for this, because in the UK, the economics are the most important thing, according to our government, more important than the well-being and the improvements to people's health. And we have that argument too. So that's a little bit of my journey.
Дякую.
Thank you.
А що допомогло, які аргументи
But what was the rationale? What kind of justification or arguments helped you to convince to roll out this process? What kind of words did you use? What do we need to say to our government if we do not have economic evidence yet at this stage?
Yes, so there are a few things that happened in England. So the first was, and the thing that made the biggest difference, was that doctors and clinicians were advocating for this. And that gave it credibility. And typically, and I don't know if it's the same everywhere, but in England, the doctor and the clinician's voice is key to the government and future changes to the health service. So it was when high-profile doctors started to say the current system and the current structure isn't working. So that was one important element. The other important element was around the increasing demand on the health service. So even though social prescribing was quite yes, we believe in this, we will do it. It was over 5 or 10 years that they tried, they tested, they had more support. And lastly, and we would say most importantly, patients were talking about it in a positive way. And ultimately, the government leaders and the politicians who control the money, they are appointed, elected by the wider public. So when we could show that the public and the patients wanted this and they felt it was the right move for the health service, and they would talk about how a creative activity or a community group had made a bigger difference than a pill or a medical advice, that really helped the leaders to see that this could have validity.
So the voice of the public and the voice of professionals is really important, right? And it's also important to showcase what you already have and to show how efficient is what you do. I have a question to you, Oleh. Charlotte has spoken to us saying that doctors supported this idea, but you said that in your practice you see the power of arts as well. So how do we spread this practice? How do we raise the voice of doctors so that it is heard? And how do we inspire them and motivate them for advocacy? But, well, you know, our context varies and it's different from what you see in the UK because it's about the number of patients that we serve. The World Health Organization reports that if we had the war over now, we would receive 4 million people affected by war because they need some medical interventions because of their mental health condition, and some 7 million who need psychosocial care. You can just think about these numbers. They are huge. That is why this is a challenge, that if we do not give a service to people, we will have a pretty bad situation. Let's put it that way. Yes, putting in mind. But unfortunately, Ukraine psychologists, psychotherapists, and psychiatrists do not have such a strong voice as you had it in the UK, because medicine and medical education did not envision studying of such processes as music therapy or some other activities. It's quite recent and new for Ukraine when we have physical rehabilitation even. It's quite a new occupation for us. I think that was in 2017 that we had this occupation registered for physical therapists. That is why, yes, we understand this talent and we try to be on the lookout for alternatives and to try to learn something new. We know that in 20 in the 21st century, there is proof that we have neurobiological impact and effect. And I know that arts matters way more than just this outcome. We know that it's also about advancing neuroplasticity through arts, neuron connections. They increase and neurogenesis. So in case we have any trauma, moral, physical, we know that it damages these connections in our brain. That is why if you really want to help people, well, luckily or unluckily, the medication that we have, injections, all other ways, they cannot really help us with the entire variety of mental health conditions that we face. That is why we started learning arts and exploring arts. And I will take this idea from you because I really liked it, that this is actually arts on prescription, is prescribing arts, and I really love this idea. And we have two types of therapy. We have arts therapy prescribed by doctors. That could be weaving, that could be writing as art therapy, it could be music therapy. Another one would be painting and drawing as art therapy. Collage. It's a neuropsychologist and psychiatrist who prescribe it because they know the patient, and if you know that a patient played a musical instrument their whole life, and that it means that you can also resort to the use of this musical instrument. Yes, well, let it be not a tuba, but a different musical instrument, because I see that some of you are traumatized hearing about this musical instrument. But yes, it's not only about treating, it's also about establishing a diagnosis. We see those parts of brain which are damaged when we practice it. And the second venue is art therapy, which is recreational. Something that we use for regeneration when we have our patients at our center, our lab, and they can do whatever they please to do. And both of these things give us neurobiological changes, which are reinforced by the fact that this is what patients enjoy. And this is some sort of addiction, but we like this kind of addiction, right? This is what we like. That is why it is extremely useful. But it's really important to be trained. It's a new field for us. It's important to share this knowledge. We already trained our surgeons in our hospitals that if you have a patient who practices art therapy when it was prescribed, and we know that that we discharge them earlier. And for surgeons, you know how important it is to discharge a patient. That is why, of course, maybe we are going to extremes a little bit when we focus too much on neurobiological foundation, but it's so important for this area to actually be there. We change the foundation, we change the lifestyle of people. We really need to do that, because if it is a moral, physical, psychological trauma, it drastically changes a human. It means that you cannot go back to this previous condition that you had, no matter how hard their family wants that. But if you have these neuro exercises in the format of art therapy, a person individually, yes, supported by doctors, social workers, psychologists, the person can create a new lifestyle for themselves, which is effective, which could be even better functioning than before after sustaining a trauma. In science, we call it post-traumatic growth. I disagree with this concept. There is no growth. You have a change of a lifestyle. Is it growing or maybe it's not growing? I think that is already secondary. And this new way of life is something that makes a person thrive. That is why our task is to be trained, to train other people to treat and to conduct research, to explore it more, because there is a lot to be explored. We are grateful to the Canadian Red Cross Society for believing in us, and we have a joint research. We have joint research now amongst the population of patients who underwent captivity and torture, and we are just trying to learn whether neurotherapy and neurofeedback works better, because they are both tools for neuromodulation, and maybe if we use two of them, it will give us even a shorter timeline in terms of discharge from the hospital. Maybe there will be more changes in lifestyle of a patient. It's really interesting, and I think that yes, if I will have an opportunity, I will go into the specifics even more. Iryna, and maybe you could tell us more about your experience. Does it really make sense for us to share about this with doctors, and what is your feedback? I thought that your question would be what it is that you do between these two extremely wise doctors. My impression is that when we have such deep, profound expertise that other doctors have, the government doesn't seem to listen to them, but I know that the city of Lviv listens to experts and their expertise. So how do we arrange everything in that way that we can scale it up? I will reveal a secret to you. On Saturday, on Sunday, we will have a discussion with Svitlana, and Svitlana will tell us more about the plans. But 5 minutes, that was the plan for us to have a conversation before, but we met just before the meeting started. I joined you after attending another event. We had an extremely nice briefing at a local park in the city, despite the heat, where we announced about an extremely important event which will take place on the 11th of July in our park. Those of you for whom it's possible to attend, we will be happy to see you there. It is absolutely critical, because there was this extremely important phrase that I would like to read out now. The city creates a space in which the word, music, and some concrete support to the military and those affected by war became one whole.
So I think that this is a great phrase that sounded at this briefing, because we will have an event there, and Serhiy Zhadan, an author, Ukrainian author, will read his poems there. He will show his artworks, and at this event, the city residents of Lviv will be able to be present, as well as other guests will be able to attend. There will also be war veterans there who need this healing by art. And I first met one of the veterans who was born in Crimea, and that veteran wrote a piece of work. Oleh knows about it. He wrote a play, and so this play was performed at the City Municipal Theatre by Lesia Ukrainka, and the play was called A Playlist of the Traveler. That was the name of the play. And after this performance, it happened in a small stage. I don't remember how many I don't remember the size of the audience because it's a small stage, but after this theater performance, the city mayor made a decision that we would invite all the officials there, I mean the leaderships of all the units of the city administration of Lviv, and they would also invite the leaders of the state enterprises, so that each and every person could feel and see and hear the stories of former military, and so that they can think about this problem that's present in our society. I think it happened 2 years ago, maybe a bit more. It was a very difficult play. And what's more, I started coughing during the play. It can happen with me sometimes. And one of the actors had some tea, so he gave me a cup of tea from the stage to the seat where I was sitting. And after the play, he said, if you could give me back the teacup. And I was thinking, like, it's real tea, right? It's so hot and helpful. And I was sitting somewhere in the back row of the theater, so that's the story that I experienced. And after that, I met this Ihor, the veteran, right? His name was Ihor. He is not a simple man, and he had this idea. He wanted to have his own theater. We had a difficult conversation, and I talked to Oleh after it about how to communicate in the right way with this person, with Ihor. And after that, we started working in a bit of a different area. Here at Unbroken Rehabilitation Center, we opened a small pottery workshop. And the people wounded, and I don't think just military, but also civilians, were able to work in that pottery workshop as part of their rehabilitation. Right now, we have several spaces, and I will tell you about them. And by the way, we could also maybe organize a tour around these spaces for you, because we opened a so-called music studio that's called the Music Center, because we have a choir also in the organ hall in our city. So in that center, in that music center called Homin, we teach veterans, we teach people wounded, we teach other adults who need it. So we teach them to play musical instruments quite seriously. If I may, you don't teach them. You work within the prescription, art prescription. So it's not teaching, it's art prescription. Yes, I apologize. The prescription is the correct term. But let me share about another project. This is our theater called Unbroken. I don't know if some of you attended the performance. The day before yesterday, some of you saw the play, right? Next to the city hall, right? Okay, wonderful. Bravo to the play, to the performance. The director of the lift, it was called the director of the lift or the director of the elevator, and I didn't know who that person was, but later I met the guy. His name is Roman. He's from the Shostka town, and I talked to him over the phone about something unrelated, such as lodging, housing, etc. And he was so modest, I was not able to drag any extra word from him. But when I saw him perform on stage, I was like, is it the same person? So personal experience is crucial, right? Exactly. And yes, it's similar to what we talked about during the previous panel, where we said that the economic results are important, and if the leaders or representatives of the governments come together and experience this contact with art, it can also help move things, right? However, let me tell you that it was not the task of the government, right? It was the task of the city. It's the task of the government, but it's also about survival, because if we don't do it, we will not survive after the war. Because in the United States, after the Vietnam War, the Americans lost 56,000 soldiers in Vietnam. And post-war, they lost 100,000 veterans to suicide. So these are huge numbers, and look how different they are. I know we are in a hurry, but the Ihor guy you mentioned earlier, well, there's this patient index that I call. He's one of the first patients who helped us implement this. He was a very difficult patient, a severe one, both physically, mentally. He was a prisoner of war. He suffered torture. And once he talked to me and he said, Oleh, could you please help me find a ticket to the opera? And I was like, oh my God, thank God that he got this idea, and I bought him a ticket for the whole month, so he was able to go to the theater for the whole month straight. He disappeared for 4 months, actually. I didn't see him for 4 months. Again, a very severe patient. So 4 months later, he knocks on the door of my office, and I see a very different person enter my office. I don't recognize him. The hairstyle, the haircut, the complexion, the clothing. I was like, Ihor, is that you? He says, yes, that's me. So for 4 months, he attended each play that was on the opera theater. He had an assigned seat in the opera house. He met all the actors there. Why was he a bit angry when he talked to me? Because he thought about a ballet performance. Then he wrote a play, but his idea was a ballet performance, similar to the American ballet company B, ballet performance about the war that was staged after the war in the US. So he's a prototype of the treatment art therapy. Of course, therapy is about cathartic experiences, but he was a severe patient, so he had become an elegant person attending the opera plays. Yes, but you know what's important? A theater director contacted me, and he said, because I represent the city government, and so she asked me, could you please organize trips for us to Odessa, to Chernihiv, other cities? And I asked, why there? And she said, because the guys who completed rehabilitation at the Unbroken Center, they called me in tears and asked, how are you? What new things are there? What other activities are you implementing? And so we have to visit them with the theater. We have to visit the guys in their cities. So this is what the city does, very briefly. Of course, there's a lot of activities. Those are just a couple of highlights. Right. So the question is how to scale this up. First thing. And second, how to make it more regulated. This is what Chris said earlier. How to introduce it at the policy level, be it local policies or national policies. It's very simple to do, actually. The city, well, I believe in communities. I worked in state service as well. We need the state to fund communities. Communities can do everything. And currently, the city of Lviv, in addition to mental health centers within hospital, the city created 6 mental health centers in the communities of the city. In addition to that, Homin Center is the prototype of the next clinics. I call them clinics, such as music clinic, text clinics. Lubko Derez, do you know him? He's an author, Ukrainian author. So together with him, we are working on creating a text clinic, which is very effective in contusion cases, weaving clinic, painting clinic. Where can we establish this? For example, in an art gallery next to your house. It can be placed at any school, at any theater, but the city has the duty to avoid problems with crime, to avoid problems with alcohol abuse, drug abuse at mass scale, not a psychological aspect, but as a self-treatment for stress and consequences of stress. So to avoid that, we should scale up this activity that we do. So when the city feels the need, and it will feel the need when the cases of suicides grow, when the cases of alcohol abuse grow, well, maybe we should start doing it before these cases grow, right? Maybe together with the city administration. art prescription in Lviv. It could be the first city in Ukraine who implemented the prescription. Let me share another case. I have to share it with one person at a time, please. So after work, I'm going home in the evening. There's a young man sitting in an old jacket and a hoodie. He's drawing a picture at King Roman Street, and I see that he has one of the legs amputated in a wheelchair. So I stopped and said, "Hello, can I introduce myself?" He's from the Halachina Rehabilitation Center. He's a professional artist coming from Kharkiv city. His mom lives in Odessa city. His name is Vasil, a young guy, 24-year-old, an explosive wound, mind wound. He was serving in the military, so we made friends, and I see him at every location in Lviv. He paints and draws wonderful pictures, and we're organizing an exhibition for him. So this is just an example of love to a person next to you. Yes, and well, just the last question I want to ask, because we have so little time left. So Chris, a question to you. As you can see, there are a lot of initiatives, activities. The city does a lot. There are many other cities doing a lot. However, it's all fragmented. So how to integrate all of that? How to bring this together? How to start all this policy framework?
Excellent question. And I've intentionally not said a lot during this because, first of all, you've heard me speak a lot this week, but also I was really loving what you guys were saying, and I just wanted to listen and absorb. Integration is the key word. One of the problems with social prescribing implementations around the world that I've seen is that it was set up as complementary medicine or a secondary line of approach or separate from the health system. And what was the great insight of Dr. Oleh's work in Here and Unbroken is that the arts began as actually a diagnostic tool. And when you began to notice the change, rather than thinking of it as a secondary approach, it was part of a integrated, holistic approach. And that's what the social prescribing framework in Ukraine has to imitate. The other advantages you have here, you have existing systems and networks. You talked about in Lviv the 5 community mental health centers, but also throughout Ukraine, you have a very strong community health, public health system, and that can be taken advantage of. So what are the other assets you have? You already have a master's program in creative arts therapy out of Kharkiv. You have here in Lviv at the Arts Academy, the first minor in art therapy that's going to be launched in September. You have the first arts and health certification program that's emerging from the Ukrainian Catholic University here in Lviv. So there's the beginnings of both a capacity building and a legislative framework, because a regulatory framework, because in order to have that certificate, you have to actually have a standard, and that's important. So we met with the mayor this week. We talked about how Lviv can become a searchlight city for arts and health, not just for Ukraine, but potentially for Eastern Europe and beyond. But part of it has to be looking at it as not separate from the health system, but integrated into it and integrated into the educational system. One of his ideas was to say, let's take advantage of these networks, but also put it in the schools, have kids investing not just in arts education, but understanding the ability of the arts to help regulate their feelings, their moods, their mental health. And mental health itself, even though there's been a lot of attention and progress here in Ukraine, it hasn't been fully funded, is my understanding. And so it's also important to think about arts and health not as a separate program, but as integrated as an essential part of the larger health strategy. And so that's what's key. So I offer our assistance, yes, we can share with you other models that other countries have done, and I think you can cherry pick what's interesting to you. But I also think that there are unique assets and advantages here in Ukraine where you have the opportunity to do it better based on the innovative, groundbreaking work that you've already done.
І тоді буквально заключне
Well, just a final word then, following up on what Chris said, maybe Charlotte and Iryna and Oleh, if you could say just a couple of words, key takeaways from this discussion in terms of art prescription, maybe some advice to us as the community. Just one word? Maybe let's start with Charlotte. Charlotte, if you could start.
Hi, thank you. Yes, that's right. I think two things. One, as Christopher says, look to embed it in existing national policy. And I spoke about how in England it was a requirement of the primary care GP contract. So look at what existing infrastructure is there to manage and fund health systems and embed it within those. And the second thing is, in England, they recognise that we do need a central coordinating body that holds the evidence and shares the evidence and the best practice, and that's the National Academy. So you don't have to create a new infrastructure. You could build on an existing infrastructure. For example, in Wales, the government has funded the Wales Council for Voluntary Organisations, an existing charity, to be that central coordinator. But I think investing in some infrastructure to enable this to move forward and making the most of existing national frameworks, policy and funding mechanisms. Thank you.
Just one word that I want to say, it's love. If you love something, you will do it. Wonderful. That was great and important. Yes, and I think that love and responsibility also wonderful. And yeah.
I'm going to say a different word from love, but it's related. And I think the people in this room embody this word, and that's compassion. Compassion comes from the Latin root compassio, which means struggle together. That your success is my success, your failure is my failure. To achieve our goals, we have to struggle together, and by doing so, we will thrive.
Дуже дякую нашим панелістам.
Thank you, our panelists, our listeners. I'm not sure whether we have an opportunity to open up for a Q&A session. Probably not. Thank you, everyone, for participation. We are going to break for 5 minutes. Apologies for the delays that we have with our agenda. Thank you.